Dr. Anshul Warman, practicing dermatologist and cosmetologist at Apollo Hospital, Ahmedabad. Who doesn't like to be youthful? And vanity doesn't stop at any age. Today, in my retinol guide of do's and don'ts, I'll share some secret tips on how to incorporate a retinol in your skincare regime. So what is retinol? Stay tuned and we will see that how you can really get the best out of your retinols. So there are certain principles of using retinol. To understand, we must know that retinol is a skincare product which is at present considered to be the most effective in anti-aging, in correcting skin fine lines, in preventing wrinkles, in controlling your age spots and fine sunspots which are gradually coming up on your skin. It also helps in combating acne. So it's a powerful skin corrector. But it also has its own set of rules. The first discussion is about the do's, that you understand how and when to start your retinol. So whenever you start, you have to be very slow and gradual. In your skincare routine, maybe you can start just twice a week, maybe just alternate nights, and gradually step it up. The best age would be in the late 20s or the early 30s. You must start your retinol not on a daily basis, then at least at some point of weeks with your dermatologist prescription. It will always give you the best prevention of aging. Then you should always use a sunscreen in the morning whenever you are using a retinol. That is very important to get the best result and to prevent its irritation potential which a retinol can cause on your skin. Whenever you are following an AM/PM routine, retinol stands its place at the night time. So when you are applying your night cream, that should contain a retinol. Your day cream should be avoided of retinol. When you're following a CTM routine, you're cleansing, toning, moisturizing. At night, first you cleanse your skin, you tone it up, then comes your retinol. You apply it all over the face, don't forget the neck, and then wait for 20 minutes to set in. Then you can use your moisturizer. You can also experiment with overlapping and layering products, wherein you can use a hyaluronic acid, a niacinamide, some essential oils, maybe azelaic acid if you are prone to acne, prone to breakouts. All these can be happily and easily combined with retinol. There are combination products available. There are products which you can layer up on. First you use your serum and then you use your retinol with certain gaps. That also gives good results. Also, whenever you are using the retinol cream, watch for the skin irritation. So if your skin is beginning to break out, then you must change your routine. And whenever you are using it, don't forget, more is not always better. So just use a very small size of pea-size amount for retinol, whereas the sunscreen you would use at least 2 fingertips. But for the retinol, it is just a tiny bit which will be sufficient to work on your skin. Also, when you are using it consistently, just be patient, because the glow that you are wanting, that you are dying to achieve, will come very slow. It is not an overnight process. So while you are trying to prevent and defy aging, while you are trying to control your acne, consistent use of retinol along with a planned skincare will always show results. Always read the labels that the products that you're using. Always consult a dermatologist whenever you are in doubt. Coming to the don'ts, which are equally important for retinol use, you don't have to use a retinol with an AHA, BHA serums, because they also have an exfoliating potential. So the chances of irritation, the chances of rashes, breakouts will always increase. So just take care of that. You can combine it with milder serums, essential oils as I mentioned, but not with the AHA, BHA. If you're already using an exfoliator, you're using scrubs, you're using going for microdermabrasions, avoid using a retinol. If you have too dry skin, sensitive skin, atopic tendency, that means your skin is too dry and itchy all the time, then retinol is not the right product for you. You'll have to consult a dermatologist and then decide how frequently can you use it and how best you can combine it with other moisturizers and barrier creams. Then don't neglect the signs of irritation if you're using too many products on the same skincare routine. You can phase it out for some time. If you're using a retinol, maybe you would want to try some serums and AHA, BHAs at other few months, or maybe depending on the season also, because retinol causes dryness, so you can save it for the summer and the monsoon season. For the winters, you can use certain milder ones. That is also a possibility. Again, if you're too much in an air conditioned environment, it tends to dry up the skin. So just be careful during retinol use when you're all the time in an air condition. When you are using the retinol, make sure that what your friend follows a regime, that same regime would not work for you. So just be careful, be cautious when you are following it blindly. And what works for somebody else might not work for you. If you're due for your laser hair removals on the face, if you're due for your hydrofacials, medifacials and other laser toning procedures, then avoid your retinol for a few nights prior to the planned procedure or the planned session. Your dermatologist, I'm sure, will always guide you for that. Especially, I tell my patients that if you're having a function coming up, if you have a continuous few days of heavy makeup, then avoid the retinol at least 2 to 3 nights prior, or maybe a week if you have too drying tendency. So make the best out of it and have a youthful skin.